issues before where it stopped recording midway. So fingers crossed.
Okay. I'm sure everything will go well. So, guys who are present, I'll just talk about a few housekeeping rules. Please, let's try and keep our microphones on mute. Let's keep our cameras off because it's going to help with the connectivity. Regina Mary, please, let's get the camera off. It's going to improve on the connectivity as more guys keep on joining. Once the cameras are off, we have better internet connectivity. Our today's session is going to be more of an interaction with Mr. Richard. Hello, Mr. Nelson. You're most welcome.
Hello, how are you, Ziada?
I'm fine. How are you? I was just going through a bit of the housekeeping rules, and that's what it does.
Can you hear me okay?
I can hear you okay. I don't know about the rest of the participants. Guys, we shall be using the chat box. If you have any questions, you have any comments, I'll be reading them as we move along. Please, let's use the chat box, but I can hear you okay, Mr. Nelson. Thank you so much for being here today. I understand what a busy schedule you had, but we're very grateful and fortunate to have you amongst us today.
Yeah, happy to be here.
I'm sorry, Ziad, if I could jump in. I have someone who is sharing their screen. We need them to close that.
Okay.
There we go. Never mind. They just did it. Thank you.
Okay, so just remind us a few housekeeping rules, please. Let's turn our screens off. Let's turn our cameras off. Let's keep our mics on mute. It's going to help with the connectivity because as people continue joining, once the screens are on and the cameras are not off, it will interrupt the internet connectivity. So we're going to get started. And good afternoon, everyone. I hope you're all doing great. Thank you for taking off the time to join us for today's session. And I'll start by introducing myself. My name is Ziada Zalwango. I am a pharmacist, and I am a certified project management professional with over 10 years of experience investing in the private pharmaceutical business sector, more so in the areas of retail management and pharmaceutical commodity distribution. I am also a co-founder of Zakedo. Zakedo is a local NGO where we focus on increasing accessibility to quality essential healthcare services, the urban slum and rural communities in Uganda, with a key focus on reproductive healthcare service provision. I'm very excited to be here today with all you guys, and I'm going to be the moderator for today's session. So if you're joining us for the very first time, just a little bit about Women in Pharmacy, because this is a Women in Pharmacy session. We are an online community practice that is bringing together women in pharmacy across dynamic areas, whether it's in manufacturing, whether it's in supply chain and distribution, whether it's in importation and exportation of pharmaceutical commodities or clinical service provision in Uganda. And we felt there was a need to come together as healthcare professionals to bridge the information gap between our sector and individuals or development healthcare partners that are at the forefront of ensuring creation of innovative approaches and mechanisms to improving of the healthcare service delivery in Uganda, and specifically with a focus on the pharmaceutical sector. We hope as we gain information and knowledge about the different changes within our sector, it will enable us to attain the required skills and build the competencies that will continue to keep us relevant and visible to our essential stakeholders. So I would like to take this opportunity to introduce our guest speaker, and that is Mr. Richard Nelson. Mr. Nelson, we're very excited to have you amongst our midst today. You're very welcome.
Thank you. I'm very happy to be here with you today.
Yes, and I would like to take this opportunity to invite you to say hello to the participants and tell us a bit more about yourself.
Okay. Great. Well, thank you, Ziada. And first, let me mention that I have two of my who is actually up very early in the morning. She's based in Washington, D.C. right now. And so she's helping out with the management of the call. So thank you, Lauren. And then also I have Rose Okochono, who is part of our health office, who helps to oversee kind of our health systems work, and has been with USAID for a while and is one of our experts on staff. So she is here, she's Ugandan, and she can help to provide some perspective that maybe is beyond what I could provide. But I am grateful to have had the invitation to join you today. I have just arrived in country in January, so I was just starting to get familiar with the country when the COVID crisis hit, and so I've been a little bit restricted in terms of my ability to get out and about and to meet people and get familiar with the country. But I've done my best, and I'm feeling like I'm definitely feeling like it's home. So my family and I love it here so far, and I'm going to be here for a while, for several years, and so we're looking forward to that. Just a bit about me. As the mission director at USAID, I basically oversee all of USAID's operations and programming in the country. And the mission here, the USAID mission here, is quite large. It's about the 10th largest in the world. And so it's very active, very broad. We do just about everything. And it's exciting. It's exciting to see all the different ways that we're partnering with the government, where they were partnering with the private sector or with civil society, to help try and help the country of Uganda reach its goal of becoming a middle-income country, becoming self-reliant and not dependent on foreign aid anymore. We call it our journey to self-reliance. And to us, that is our clear goal. Everything that we do, we're trying to work with our partners around the world to move our partnerships to a point where it's not based on foreign assistance, it's based on mutual interests, on trade, on political alignment, those kinds of things. So this is a means to a longer term end. Personally, prior to coming here, I was just very briefly, I'll just mention kind of my background. It's a little bit different. It's an unusual path that I've taken. I've been with USAID now for about 10 years, 7 years of that as a lawyer for USAID in the Foreign Service, working in Washington, in Baghdad, in Bangkok, and in Pretoria, South Africa. And so I was working with a number, well, I calculated once, I think it was over 22 different USAID missions that I was working with during that period of time on a regular basis. So I ended up with quite a good perspective on what USAID does around the world. And then about 3 years ago, I moved from the lawyer work, the legal work, to management, and I was helping to run USAID's, well, the US government's Power Africa initiative. It's working across the continent to try and double access to electricity by the year 2030. And so that was exciting to be a part of that. Before I came to work for USAID as a Foreign Service officer, I was in the private sector. I was in the private sector for, I don't know how many years, 12, 15 years, something like that, doing a variety of different things. I worked for Dell Computers as a kind of global strategist, and would work very closely with governments around the world when we were trying to build a new call center or a new factory or something. So I worked a lot with investment promotion entities and the development arms of governments, mainly in Asia. Before that, I was an investment banker, working at a bank in the US, working on very large capital markets credit facilities. But I loved that work, but it was only domestic. It was only in the U.S., and my heart was always um, looking for international experience, and so that's why I moved out of that. And before that, I was an attorney. I was a banking attorney, banking and finance attorney, um, working in a firm on the East Coast of the United States. Um, so I've had sort of this strange route of being a lawyer and then a banker and then working for a multinational corporation as neither a banker nor a lawyer, and then coming into USAID doing legal work, sort of more purely compliance legal work, and now in a management position. So I've experienced a lot of different things, and honestly, I never would have predicted it, but it's been very, very fulfilling. And at times it was scary to jump out of the space I was in. I was a little uncomfortable, but in each case, we really felt it was a family decision in each case. And we always felt like it was the right thing for our family and the right thing for me. And so I have no regrets about any of it. It's been interesting. I will say this: my second daughter, she's now 21 and she's living in the States. But sometimes she finds, we've talked about how I was in law school. I had offers to go work for big firms in London and basically just go down a legal path, working my way up to be partner in a big global firm. Living around the world, and it seemed exciting at the time, but when it came down to actually taking the decision, we just didn't feel good about it. And so we took a different path without even knowing what we were going to do. I declined the offer without any other option on the table and quickly had to find something else. And like I said, I have no regrets. It's worked out quite well. But my daughter, though, she sometimes asks me, like, Dad, how come you couldn't be a real lawyer and be making lots of money? And that's what she was thinking about. But it's been a fun journey up to this point. And like I said, we're thrilled to be here in Uganda. So and just I have 3 daughters, one that's 25, one that's 21, and one that's 15. And the 15-year-old is with us here. So.
Well, thank you so much for that, Mr. Nelson. And I'm sure you're going to love Uganda. We are a very welcoming culture and an exciting group of individuals. When you start moving around, maybe you would actually come and meet us as a Women in Pharmacy group, and we have more introductions about quite a number of things. But I'm hoping to focus a little bit more about your work history before we dive into today's theme. You have a very interesting career, like you have put it. You started off in the legal background. You go into marketing, working with Dell, a marketing negotiator for Dell as it's trying to get into new markets. And then you get into power. Now you're going into renewable energy. And here you are today, you are heading different USAID priorities along health, education, agriculture. So your work experience brings out something that continues to be rare within our Ugandan context. Our context looks like what your initial education was in legal. The expectation would have been continue growing up the ladder in a vertical direction as a legal officer until you make partnership probably in a multinational corporation. But you've grown your career in a very dynamic manner. What inspired you? What was your perspective to your career growth instead of taking a vertical path and you took a very horizontal and dynamic journey? What inspired that?
Definitely a zigzag path.
Yes.
When I was in university, I didn't know what I wanted to do. I knew there were different options. I knew I wanted to be a professional. I knew there were things that were interesting to me about being a doctor or going into business. And exploring different opportunities. For a time, I was even thinking about being a geologist. I I became good friends with a geology professor I had and loved it. But in the end, I felt like, and this is it's a little bit different in the US. You have a little more flexibility. It's a little riskier, but you have some flexibility. I knew that if I went to law school, if I became a lawyer, that it would give me a lot of different opportunities, that I could practice law, or I could jump out of it and do something else. I saw that there were lawyers in different areas. There were lawyers who were CEOs. There were lawyers who were in politics. There were lawyers who were helping to run NGOs. There were lawyers doing all these different things. So I realized, it's a good, strong academic base, and I can do legal work for a whole career if I like it and I find something that I really want to do. Or I could find a way to get out of it and do something different if I wanted to. There were other paths that I considered. You can be flexible in a lot of different areas, but that was probably the main reason why I chose law, even to begin with. Then, as I progressed, I knew there were things that I knew I wanted. I knew I wanted to work internationally. I knew that I wanted at some point to do development work. And I knew that I wanted to live overseas. And luckily I married a woman who wanted the same thing. And so our priorities were aligned. And so I always knew that was what I wanted. And then I sort of just patiently looked for those opportunities. And for the first 8 years of my career, those were not even, except for me turning down the job in law school. After that, I went to work, like I said, for a small firm. Ended up being a big firm on the West or the East Coast, but they did no international work. And then when I worked at the bank, they did very little international work. And I kept trying to get into the international work they were doing, but the doors kept closing. So I was just patient. And eventually, because I was looking for those types of things, some opportunities presented themselves. So I'm not saying international, I use that just as an example for anybody in your career. You should have some long-term goals, some long-term objectives of where you want to be. And even if they're a little bit wild or a little bit outrageous, all right, keep those in your mind and look for those opportunities on how to get there. Study people who have gotten to those places and see how did they do it. And then you start not being impatient and not putting your family at serious risk by giving up something that's secure. Sometimes you have to, but not always. And so you've got to be careful about those steps you take. But I think that's really what drove me, those long-term goals. And as I look back now, I've been able to do almost all of those goals over time, but it's taken a while.
Okay, so that's quite interesting. So let's dive into today's theme, and that is the USAID Journey to Self.
Actually, Ziada, sorry, let me just mention one more thing, if you don't mind. So if you do try and do some of these things where you're jumping from sector to sector or from career path to a different career path, the thing that I had to do was I had to really, at each step, I had to convince people that they could take the risk.
They could bet on you.
Yeah, exactly. And so the way I did that was, number one, I highlighted my education and some of those things that were sort of demonstrated that, that I was smart and that I could do smart things. And then I had to pull out those components of what I was doing that were relevant to the job that I was looking for, right? So, when I was talking to folks at Dell and they were looking at my banking experience, the work I was going to do was not banking at all. But what I did was I said, look, my day-to-day job as a banker, I am analyzing deeply companies so I can understand how they operate and how they function and their cash flow. And then I negotiate very heavily with lawyers and with bankers and other people on the other side the terms of these 150-page agreements, and it's a whole lot of negotiating. And so I knew that those were the skills they were looking for. They were looking for negotiation skills. They were looking for analytical skills. And I was like, that's what I do all day long. It's just in a different context. And I can learn your context and I'll bring those skills to this new context. And it worked.
Yes. So basically what you're sharing with us today is it doesn't matter the industry you're in, but if you want to dive into a new industry, study it, ask yourself, what skills do you have, irrespective of where you're coming from, that you can use to add value to that new industry that you want to get into?
Right.
That's what I'm getting out of that great conversation you have given us there. And I have just a comment here for you today. That amazing story, Mr. Nelson. We admire the courage you have had to turn down straightforward career path opportunities so that you can be able to follow your passion. Because some people don't have the opportunity to actually follow their passion, because of the prevailing circumstances. Yeah. So I'm thinking we should dive into today's theme, and that is the USAID journey to self-recovery, specifically looking at opportunities for the pharmaceutical sector. The first question, before we get into so many questions about this journey, is what inspired USAID's change of strategy in programming to look into how it can be able to support countries to get onto a self-recovery space, so a self-reliance space?
Yeah, good question. I really think it's always been part of USAID's ethos. It's been at the heart of what USAID has been doing since 1961. That is to try and build those relationships, strengthen our partnerships with these countries, help improve people's living conditions and their livelihoods. What happened is that we had an administrator, Mark Green, who really, I think, did a great job of bringing that principle to the top and really making it a priority, because even though it's always been with the agency, we get in our routines, we get in our habits of doing one project and then another project and then another project. And in some countries, many countries, we've been there for decades. And it just becomes normal to just, not look further than 5 years. That's the typical length of one of our activities or projects. And so what this has done is it's helped us, I think, stick our heads up a little bit out of the hustle and bustle of our daily work and think about, okay, what are we doing? And how is it really helping this country on their own journey? We're not here to do development to a country. We're here to support a country on its own path, on whatever that path looks like. And we want to help in any way we can in a constructive and positive way. And it's a little bit of a mind shift for a lot of people, because it's just, we don't think about it a lot of times. And so that really has brought that principle to the forefront. So I love that it's now something that we talk about more often and more vocally with our counterparts.
So if we're to focus on the healthcare sector, and we are looking at USAID programming and the new strategies the agency has had to employ to be able to align its implementation strategies with the journey to self-reliance for Uganda specifically, what changes have been ongoing within the Uganda USAID programming implementation strategy.
Okay.
This is different from the previous way of working with a specific focus on the healthcare sector.
Yeah, we, as the U.S. government, between USAID and CDC, we're contributing, $800 million, $700 million a year toward, maybe not that quite much. Maybe it's 600. I have to look at the numbers, but it's a very substantial amount that we are contributing toward the health sector of Uganda. And we know that that's not sustainable. Okay. We go through different political periods back in the States, and there are times when there's more support for funding of this nature, and there's times when there's less support. Right now, we're in a time of less support, and so there's pressure to reduce that. And so we know, and our other development partners are experiencing the same thing, like the British. Some of them, their budgets are tied to their GDP, and literally it's a percentage. And so if their GDP goes down like it is right now with COVID, their budget for development work gets cut dramatically. And so we know that that's not sustainable. So we have regular discussions with the Ministry of Health, with the Ministry of Finance, to talk about taking steps a little bit at a time for the government of Uganda to start taking over some of these activities. For example, we pay, and Rose, you may know this off the top of your head, within just our health, or excuse me, our HIV/AIDS program, we actually employ several thousand Ugandans. Many thousand Ugandans are working at various levels, from the village level to the health center to the ministry, where these people are actually being paid by us to do this work. And so we are actively identifying all those people transparently with the ministry and talking about, okay, how many can you start to take over? How many can you switch over to your employment this year or next year or the following year, to start laying out a path so that we have this steady progression of the government of Uganda taking over a little more, and a little more, a little more. So that's at the technical level, and Rose is involved in those kinds of discussions. I'm involved at sort of the ministry level, the minister level, and we're constantly at that very high level trying to get the Ministry of Finance and others to even shift more of the overall national budget to health and to education, as these social sectors, so that they can take on more of these costs. Rose, did you have any thoughts on that? Let me see if Rose has a comment here.
No, I think you're spot on, Richard, that clearly we have moved from where we are. Let's say 5 years ago, and where USAID is right now is really very different. Previously, we focused a lot on, get activities done, implementing partners, and actually be more involved in doing the actual service delivery. But we are now shifting that greatly to the place where we're saying we need to work and invest within the government and public sector system. We need to support the critical elements of the health system. If it's human resource, what policies do we need to drive government towards in terms of getting the right skills, getting the right mix, financing for these human resources, things on infrastructure development, so that we are not the ones necessarily doing the payment going forward, but we are identifying together with government and sharing those costs and supporting them in terms of if it's expertise that is needed. So I do see us moving in that direction and really working much, much closer with the government as we develop these different projects and these activities.
Yeah. And let me just add one other good example, and Rose helps to oversee this also, is the commodities piece of it, as an example. So with and you all are involved in this, but like the antiretroviral therapies, the ARTs, ARVs that are used throughout the country to support all HIV positive, people living with HIV, almost 100% of that is funded by us, by the U.S. government, or by Global Fund. We are bearing the burden of that to a great extent. And so that is another example of how we need to start shifting that cost burden to the government of Uganda. Now, we know that the government of Uganda has limitations on its budget. We know that. So we have other programs helping to try and increase or improve the tax system so it's more fair and transparent and broad-based, so that the government can have a better source of revenue, so that can feed into a larger budget that then can be shifted to health or education to take on some of these things.
You have shared you have shared quite a lot of information about how you're working with the public sector. And my question now is lying with the private sector, because from the previous stats, I think our Ugandan healthcare budget is approximately 7% of our GDP. It's still far away from the Abuja Declaration of the 15% that is required for each country to have. So you find that the majority of healthcare expenditure is actually out-of-pocket expenditure. People have to pay for healthcare services. And so the private sector is playing a very big role in healthcare service delivery in Uganda. When we are focusing on self-reliance as a country, what is the role of the private sector, and how is it being engaged across different components to be able to contribute to this journey to self-reliance?
Yeah, let me provide some initial and then I'll have Rose jump in, and she can speak better to the way that we're working with the private sector at that more granular level in our health programming. But in general, I mean, with health systems, there's great variety in the world. You've got the United States that's very different from many other countries, where the United States is almost all private. Okay, it's private hospitals, private, insurers, private. You get your health insurance from your employer, and then everybody pays out of pocket, either through their insurance or just straight from their savings, for all health services. Now, there are some public programs for lower income and for elderly, but for the most part, it's private. Now, it's a good healthcare system, but there's a lot of problems with it, a lot of problems. And then you have systems that are entirely public, right? And those have their pluses and minuses. I don't know where Uganda is going to go in the future. Right now, it's almost, it's mostly public. There's a lot of private service providers. I would say that as a development agency, we want to support Uganda in the path that it goes on. I do think no matter what path it follows, there has to be a role for the private sector, though. And the private sector has to get more engaged, and there has to be business opportunity for companies in that space, in whether it's developing pharmaceuticals, selling pharmaceuticals, whether it's actual service delivery, whether
Stand by. I think Richard's connection. Oh, Richard, are you back? Okay.
Hi. Sorry. What was I talking about?
You're talking about where is the role the private sector has to play in the journey to self-reliance, and how we're talking about how is it going to be engaged. Which areas does the private sector need to be engaged to be able to contribute to the journey to self-reliance?
Yeah, I think that no matter what happens, the path that Uganda goes on, there's going to be a role for the private sector. Like whether it's, I don't know if you heard me say this, but whether it's in pharmaceutical development, whether it's ambulance services, whether it's operation of a private hospital, there are so many ways that the private sector can be involved in this to help the overall health environment for the country. Maybe it's insurance, private insurance. So, you know, there is a way. I'm convinced that the private sector has to play a role in this. I mean, from USAID's perspective, we see, especially outside of the health sector, the private sector is what ultimately is going to create all the jobs for people to be able to improve, so that the economy can grow, so that people's standards of living can increase. It's not development aid like what we have. It's just not enough. We will never have enough money to really change everybody's income levels. The private sector is going to be the ones to come in and create jobs. So outside the health sector, that's a major priority of ours. In the health sector, it's a little bit more varied because there is such a strong traditional role for the government. But let me stop there. Rose, do you want to talk a little bit about how we're working with the private sector right now and looking to expand that in the health space? Did we lose Rose?
I think we did.
We may have lost her.
Let me
Well,
catch her.
One of the areas, as we're waiting for Mrs. Ross to be able to join us, one of the areas that we're very keen on knowing more about as a pharmaceutical sector is when you talk about self-reliance. I'll talk about, let me just expound this on the African continent. Over approximately 14 billion US dollars is what the African continent is spending to import pharmaceutical commodities into the different African countries. So one of the areas when we're talking about self-reliance that as a pharmaceutical sector, we would be a little bit keen to know more about is how can we support local manufacturing in our own country? At the moment, local manufacturing is being largely taken on by the expert entrepreneurs who are mainly the Indians. They come in, they're going to be given quite a lot of incentives to invest, which is not being extended to the local Ugandan manufacturer who would want to enter that space. So the constraints that are barring entry into this sector remain very high. So as a pharmaceutical sector, we are thinking about issues to do with innovative financing for local manufacturers, issues to do with capacity building in terms of taking them through what are the necessary kind of qualifications they ought to have to make sure that the products that they are producing are equally competitive on the market. Because if the Ugandan government is going to be spending money to import drugs, that same money can be spent within our economy, supporting local manufacturers to set up companies, and also creating more opportunities for the Ugandan population. So within that space, and this is not only for manufacturing, we have people on this platform who are working in supply chain and distribution. These are people who can still be able to get the same opportunities to distribute that at the moment could be offered to international organizations, international USAID contractors. So we have had the component of how USAID is supporting the public sector, the government, but when it gets to the private sector, whether it is in procurement of commodities, whether it's in supply chain and distribution of these commodities, how are they being put onto this, included into this space to build their capacity, increase their access to co-financing mechanisms, to give them leverage to also be able to contribute to the self-reliance journey.
Yeah.
Do we have any innovations or any plans for that space?
Yeah. Look, I totally agree with what you were talking about. I think the issue, why isn't there a flourishing pharmaceutical manufacturing ecosystem in Uganda right now. All right, what's holding it back? Is it just know-how? Is it finance? Are there policies in place that are prohibitive in some way, that are somehow favoring the importation of these pharmaceuticals from India and from elsewhere? Those are the things that you've got to look at, right? Where are those constraints? We have a number of different. We look at those areas. The other development partners that work closely with us also focus on these. There are so many different finance arrangements. There are big funds that are being formed right now. I mean, the Chamber of Commerce, the Uganda National Chamber of Commerce, the other one I just spoke to this last week, another business association, Ugandan Business Association. These are the bodies that can have real influence to change policy. They can help to form, like I said, there are funds that are forming. I think the World Bank is funding, and there's some other donors that are putting together some funds that can be used to finance different entities. We have the U.S. Africa Development Foundation, USADF, has a constant open window for ideas, for business expansion. And they'll make grants from $10,000 up to $250,000 to help expand. And they're looking for stuff like this. So if there's a company that's got some ideas, they're starting to grow, they just need some financing for this or that on the equity or on the financing side, there can be opportunities. Now, we're also trying to work in the finance sector to try and create more incentive for them to provide that kind of financing. So I would say it's growing. We're aware of those issues. There should be a manufacturing ecosystem here in Uganda for this, and we need to get there.
Okay, so moving on, because we're about to, we have a few minutes left, and I'd like to open the chat so that members can also be able to ask you their questions. Our participants today are working across diverse areas, like I earlier stated, some in manufacturing, supply chain and distribution, pharmaceutical system strengthening. I don't know if Mrs. Rose is back online, because this is some also of her area of expertise as well. And the question remains, COVID-19 has made quite a lot of changes in organizations, right from the way they're going to be recruiting to the kind of skill set they're going to be looking out for, to the kind of competency they need to get work done, so that we can be able to rebuild much more resilient and sustainable systems. So participants listening in here today, some of them are vying to work with USAID. What is USAID looking for in the people it want to be a part of the team? What are the skill sets?
Yeah, let me answer that in a couple of ways. Number one, our health office is our biggest office. So, if you're going to work for USAID, if you're a health professional, your chances are better than most other sectors. I will say this though, even with that, we only have about maybe 50 or so Ugandans that work in our health sector, maybe a little more, maybe 60. And many of them stay for a long, long time. So we do have some turnover. We're actually going through a hiring process. We just went through a hiring process, but where we're hiring a number of people. So there is a constant, steady stream of hiring. The CDC, Center for Disease Control, they're also hiring on a frequent basis. And so if you just look at our website, job boards, there are postings for jobs regularly there. So you can look there. The type of person we're looking for is somebody who is experienced, who is active, who can get things done, who is not passive, somebody who is easy to work with, and yet still has a track record of being successful in getting things done. Somebody who can provide direct feedback where necessary to a supervisor or to somebody else. That's the type of personality. I mean, you could ask Rose sometime. I don't know how many hours Rose puts in. She works so hard, especially there are certain times of the year in our PEPFAR HIV/AIDS work where it's just demanding. And she's right in the thick of it. And so it's not for somebody who wants a nice cushy job. It's very, very difficult, but it's rewarding also. The one thing I would also say is we work with a lot of implementing partners, a lot of NGOs, foreign and local, with contractors that are out there doing work. When I told you that we have several thousand people that we're paying for, none of those are working for USAID. They're all working for our partners. And so that's where there's a lot more turnover and there's a lot more opportunities. And maybe Rose can say something about that, about where you might be able to find those advertisements for those jobs.
Yes,
but I will say this.
And maybe throw more light on who these partners are for people who really want USAID programming. Who are some of the partners that are taking on the implementation activities of the agency? So people know exactly what to look for.
Sure. Rose, do you want to do that? Do you want to share who some of our partners are and what people might do if they want to talk with them?
Yes, so I think you probably know most of the partners, since this is a pharmacist forum. Most of our partners that engage in health and HIV do have roles and responsibilities for people like you who are pharmacists, because we deal with the supply chain. We are interested in knowing how commodities move from national medical stores, medical access for GMS to the health facilities, and ensuring that patients that we are here to serve have sufficient commodities. So definitely there is a role for pharmacists in most of our health projects. The big projects are the rights projects. You've probably heard of them. We have 5 of those in the East, North, the East Central, as well as Southwest. Then we have new projects that are coming up on board that are local partners. You've heard of TASO, the JCRCs of this world. And most of these advertise in the media. They use the newsprint. They go to, they have online, different websites online, like if you go under UN jobs and stuff like that, you will see those job opportunities. But for pharmacists, I see that the big role is mainly supporting that system for supply chain management. And those positions are not that many. But if you would want to broaden like Richard has, or like I have, I'm a medical doctor by training, but I mean, I've been in public health. So you get to be versatile. You don't just focus on pharmacy or supply chain. You can do something related to public health. So that also gives you a door to actually get employment with our partners. So those are the kinds of opportunities that are out there. So we have many that are opening, many that are closing, but as others close, new projects come on board. We have about 40 mechanisms that we are currently funding in the health office, and the bulk of those have to do with service delivery and system support and health system strengthening in regard to supply chain and also public health. So there are opportunities.
Thank you so much, Rose. And I would like to direct this question to you as well. Let's talk about health technology, health information technology. When you look at, for example, the national medical stores, hello, can you hear me?
Yes.
Oh, okay. I thought I like I had frozen. Okay. So let me focusing just on our public institutions. Let's take an example of the national medical stores. And we're talking about building capacity, for example, for country, effective procurement mechanisms for the country. We're still dealing with systems whereby most of our work is manual. There is no coordination between institutions on how we can be able to understand what our procurement needs, how we can be able to relate our procurement needs to epidemiological data, whether it's for infectious or non-infectious communicable diseases. So let's look about adaptation of health technology solutions within the USAID projects. How are we moving in that area? And what have been the advances so far? What remain the challenges?
Okay, this directly to me?
Yes, it is.
Okay. Funny that you should ask that question because we are right in the middle of doing this. Yesterday we had a call with our counterparts in Washington, just giving an update on where we are on some of our support, systems investment support to the government of Uganda. And there's a big investment that USAID in particular has started with the national medical stores, clearly to address those issues you're mentioning. Procurement, it's a big issue. We've had challenges, many partners, including Global Fund, Gavi, the US government, put in significant commodities through the public sector, and we have to use national medical stores. And one of the challenges has been for the past 3-4 years that we've not had visibility of what goes in as donors, what comes in also from government, and how much is going to the health facilities. The current system that facilities use to order and receive for commodities is so manual, and many of the facilities that we are working with don't have even trained pharmacists. They're basically using either storekeepers or store managers. So clearly you can see right through from the bottom to the warehouses, there's a problem in terms of information systems. So one of the things that we embarked on about a year and a half ago was to set up an enterprise resource planning architecture at the national medical stores. And the purpose for that is to see that we have end-to-end visibility from the warehouse right to the end user at the facility level. Of course, the challenge still remains. We are in the process of getting this system. It has been installed at national medical stores. We're now going to pilot it at facility level. But I do see one big challenge in Uganda, that much as we talk about this era of technology, implementing this and getting people to that place of using the technology is a problem. Then you have issues on power, because most of these devices, either you need to have a phone or you need to have a small tablet. So if you don't have power at the lowest level in the rural setting, which is quite common in Uganda, then you will have also undercut yourself. So even as we build this, we try to look for the simplest ways that are user-friendly, that can adapt within our current environment and context and with the limited resources. So you want to look for devices that are very simple. So for the ERP, for example, what we envision is a simple phone, not even a smartphone, but a very simple phone that costs about $10 and that can easily be charged and does not require huge power requirements. So it will be easy for them to make their orders and have visibility. So those are kind of things that we're trying to do. And we have not just done that with national medical stores. We've done it with JMS, which is a private sector entity warehouse, and that's working quite well. So we want to also see that happening as well at national medical stores. And Richard, you can chime in if there's anything you wanted to add.
No, I think that I think you've summed it up very well, and obviously you're living that day to day, and so I think that's important. I would just say I was looking through some of the comments and questions. There were a few questions in the chat box about how your business can work with USAID. The answer there again is going to be through our partners. They're the ones who are subcontracting. They're the ones who are actually procuring PPE. They're the ones that are procuring different commodities in different ways. So they are the ones to talk to and to connect with. You can, if you go to our website, you can see who is running those activities. You can learn about those things just by Googling. Rose referred to the RIGHTS, and it's the Regional Health Integration, and I can't remember what it all stands for, but it's basically these guys, each one of them does a number of different health focused activities. So they'll do some HIV/AIDS, some TB, some malaria, you know, some maternal and child health, all of those things within. It's an integrated health program focused on a particular geographic region. And so, and each one is implemented by a different partner, and they subcontract and subgrant with a lot of different organizations. So those are the ones that you'll want to connect with and talk to about whether they need your particular type of service or commodity.
Great, Mr. Nelson, you've actually answered the question, because right now I'm diving into the chat box, and I think you've just answered the question about someone saying we are local manufacturers of the KN95 masks. How can we work with USAID? I think that has been answered. We are local manufacturers of mosquito repellent lotions and sanitizer gels. How can we be able to work with the USAID? I think that has also been answered. We need to look out for the local contractors who are helping USAID implement these activities. So the second question I have for you, this is directed to you, Mr. Nelson. The questions are coming in such a high-level position that you hold, where you get to interface with a variety of government and private sector partners. They have different interests. They have different economic motivations. What are your often go-to negotiation tactics to continue inspiring them along one path?
Okay. Yeah, good question. I have seen a lot of different negotiation styles in my career. And personally, and I've actually taken, when I was at, when I was going to law school, I was at Harvard. I took the negotiation course as one of my electives, and it was very interesting because it was based on the book Getting to Yes, which was fantastic. And the whole idea is that most of the time when you're negotiating, if you really try and understand what the other person's interests are, not their position, but their interests behind the position, then you can start to figure out how you can, creative ways where you can match up your interests so you can create greater value between the two of you. And so that to me is the best way, is if you can figure out, put yourself in their shoes and really understand what their interests are, and then not be locked into your own position, but focus on your interests. What am I really interested in? Not what is my position? And then you can match up. Sometimes you have to be hard-nosed. Sometimes you have to be firm, because your counterpart is going to be firm and they're not going to budge. But I think most of the time people want to be reasonable. They want to work out the best solution possible, and I think you can do that. I just think you have to be patient. You have to be intelligent enough, emotionally intelligent enough to know, to read their body language, to read what they're saying and what they're doing, to understand what they're really trying to get at. The book is called Getting to Yes.
Getting to Yes. So that's our first book for today. We were actually gonna ask you to recommend some of the great books you had read that we can be able to drive some interesting lessons from. So the first book for today is Getting to Yes. Do you remember the author?
I can't remember. If you just look up Getting to Yes, Harvard, you'll find it.
Okay, so Getting to Yes, Harvard, that's our first book for today. Any other recommendations about books that you think have made a great impact?
Yeah, I saw that. I think Lauren just put it in the chat box, the link to the book. A few other books, I was thinking about it. It's really hard to pin down books that are, well, to narrow it down, because so many have had an influence. But a couple that I've thought a lot about over the years are The 7 Habits of Highly Effective People.
Okay.
Which by Stephen Covey. Another one that you probably have not heard of and this is called Switch. It's by Chip and Dan Heath. It's called,
Switch.
again, Switch, and it's all about how to convince people to believe in what you're proposing. Okay, and it's brilliant, and I think about that one all the time. So, and it's an easy read. It's really good. And then you know, getting to the more personal, just to kind of wrap up. I'm a religious person, so scripture, I would say just scripture is the other thing that it has been highly, highly influential in my business, in my career. And so I don't disassociate those two. I don't preach. I don't talk about it at work. It's not appropriate in my mind, in our environment, at the U.S. government. But I definitely live by those standards. So that's what I came up with.
Okay, thank you so much for that. So as we're wrapping up, my last question to you for today is, what the question we have in the chat is, some USAID Uganda positions are advertised when they're specifically looking out the Ugandan nationals. Why is that the case?
There's a combination. We have a lot of different ways to hire people. And we have, like I said, we have about 140 people that work at USAID here, and about 100 of those are Ugandans. So by far, we hire more Ugandans than anyone else. But sometimes there are certain positions, maybe because of certain classification and security, you know, there are certain things that only an American is allowed to do in the embassy. It would be like if I were working for the Ugandan embassy in the United States, I'm sure there are things that they would only want a Ugandan to be involved in, not an American. And so that's really what it comes down to,
Okay.
more or less. Yeah.
Okay. So thank you so much for your time, Mr. Nelson. I know you're heading out for another meeting, and we have come to the end of our session today. Just one last clarification. You talked about the U.S. Africa Development Fund. Is that it?
Foundation.
The U.S. Africa Development Foundation, because I've been having quite a lot of questions, people asking, we are in the private sector, private industrial sector, pharmaceuticals, how can we get support? And just to answer the question, everybody who is asking, please Google U.S. Africa Development Foundation. Mr. Nelson has told us they have quite a number of grants that you can be able to apply for, pitch your idea, and you know, you see how it goes. So thank you so much for your time, Mr. Nelson. We have learned great insights from you. Thank you so much, Dr. Rose, for your time and also the insights you've been able to share with us. And lastly, thank you so much, Lauren, for making this happen. And we come to the end of today's session.
Right. Thank you so much, Ziada, and everyone else. Thank you for your time. It's been my pleasure to be a part of this discussion. I hope that some of the things that Rose and I have talked about will help you in your career and in your business. I want all of you to be successful. That is what I really want. And so hopefully something we've said today will help you in that effort. So thank you and best of luck, and I'm sure we'll see each other around.
Yes, Mr. Nelson, we shall be waiting to take you out for a cup of tea as Women in Pharmacy Group. Let's wait for the lockdown to, you know, things to really get better. Okay, have yourself a great afternoon, and bye-bye.
Thanks, everybody. Goodbye.
Okay.
Stay safe.
Bye-bye.
Thank you so much, Sada. So I will work on getting the recording set and then sending out the details to you by Tuesday. Usually takes about 24 to 48 for it to kick back to me in the system.
That is great, Lauren. Thank you so much. Are you send to all our emails, or you send to me and I disseminate to the rest?
What would be your preference? I can send it to you. I don't know if you have a note you want to attach to them, or I can send it to everybody. It's up to you.
It would be great if you send it to everybody. We all get it at once. That would be great.
Great. Thank you so much.
Yes. Okay, thank you so much as well. Have a great afternoon.
You as well. Thank you all.
Okay, bye-bye.
Bye.